And good morning, everyone. I'm Jennifer Dietz, Director and Associate Dean for Stanford Continuing Studies. Thank you so much to all of you for joining us today to take part in Discover Stanford For You. We're very excited to bring you this event. It's being co-sponsored by Continuing Studies and by the Office of External Relations. I'd like to walk us quickly through our agenda for today. We will begin with opening remarks from Martin Schell. Then Matthew Tews will share his thoughts on Stanford's legacy. We'll hear next from Bonnie Maldonado, who will discuss what we know now about COVID-19 vaccines. Then, after a short 5-minute break, we will regroup, and Chris Field will join us to talk about the latest issues in climate change. Both Bonnie and Chris's presentations will run about 10 to 15 minutes, and that will leave us time after each of their talks to take questions from the audience. You can type your questions into the Q&A window at the bottom of your screen. Today's event will then close with reflections from Srinija Srinivasan. And now I'd like to turn it over to Martin.
Thank you, Jen. Good morning and welcome to the first ever Discover Stanford For You. I'm Martin Schell, Vice President and Chief External Relations Officer at Leland Stanford Junior University. It is our distinct honor to welcome hundreds of our neighbors, alumni, and friends of Stanford to this virtual tour and engagement event. Thank you for joining us today. Before we dive into the substance of today's webinar, we would like to take a quick poll. We would love to know who has joined us today and where you are viewing this event from, and what best describes your relationship with Stanford. Look at your screens and respond to the questions. We will take a moment to allow everyone an opportunity to reply. So why don't we see, do we have most of the votes in? So looks like about a third from the Mid-Peninsula and 20% from the South Bay, another 20% from other parts of California, and 20% outside of California, and 10% from outside the United States. Wow, welcome, it's great to have you. And look at the making up here. Looks like 40% from within the Stanford community directly, another 20% of our alums, 5% of Stanford parents, welcome parents, about a little over 10% of our neighbors are from our government and elected officials, as well as the nonprofits and other visitors. Wow, this is a great turnout and a great representation. Thank you all. So as many of you know, Stanford has called Palo Alto and the Bay Area home for more than 125 years. How the university came here and its history of struggle and triumph mirror similar histories of the Bay Area and that of California and the United States. Born out of the depths of deepest despair, a couple losing their only child to typhoid fever a few weeks shy of his 16th birthday, Jane and Leland Stanford a vision in place where the children of California would become their children. They named this institution not for themselves, but in memory of their son, Leland Stanford Jr. They donated their farm in Palo Alto as the site to this memorial for their deceased child. Thus, the Stanford campus to this day is oftentimes referred to as the farm. As we fast forward from its founding in 1891 to 2021, those beneficiaries of Stanford's hope and vision now come from around the world. In a moment, you'll hear from our colleague, Matthew, who will share more history on the legacy of Stanford University. While Stanford has emerged over the past decade as a global research university, we are entrenched here. This is our home. Some of us are convinced that the university's advancement over the past century is inextricably intertwined with that of the Bay Area, California, and the West Coast of the United States. And yet, sometimes as an international institution, we may not always be thinking as much about our friends and neighbors who share the same region as Stanford's home. We established a new Office of Community Engagement a bit over a year ago to help us become more connected, or maybe to be more reconnected with our various external communities. This webinar is one of many ways we are working to engage and re-engage with you, our neighbors near the campus and around the world. Before moving into our program, we also want to provide a brief update on some of the challenges and opportunities that have presented themselves to the university over the past 12 months. As we all know all too well, the last year has presented unprecedented challenges to our world and to Stanford itself. When the threat of the pandemic became clear last year, the university refocused operations entirely on responding to it. We transitioned to online learning, pivoted our research enterprise to address the pandemic, and closed our campus to all but essential workers and a small subset of students. As we enter the second year of the pandemic, supporting our core mission of teaching and research, we've tried even harder to put this as our primary focus. Even as other universities made the decision to go virtual for the entire year, we tried very hard to make in-person teaching and research possible. We welcomed back this fall all graduate and professional students to the campus, totaling more than 6,000 students, and as well as a group of undergraduates with special circumstances, and that group now totals more than 1,000 students. We remain hopeful to be able to be back on campus this spring with our junior and senior undergraduate classes if the state of the pandemic and the public health guidance allow. In a few minutes, you will hear directly from one of the world's leading epidemiologists and infectious disease researchers, Bonnie Baldonado, on this year of COVID-19, the race to develop therapies and vaccines, and the ever-evolving plans for vaccine distribution. Even as Stanford continues to respond to the current crisis, we are looking to the future and thinking about how we can apply the lessons from this experience as we work to solve the challenges ahead. There are three lessons in particular that we believe will help Stanford over the long term as we continue to advance, along with the contributions we hope to make to help the world. The first is an increased focus on accelerating the application of knowledge, along with a steadfast commitment to fundamental research. Application only is able to be done when fundamental research is in partnership. When COVID-19 reached California in early spring, Stanford researchers rapidly pivoted. Members of our community worked effectively and efficiently with external partners to develop diagnostic tests and to hasten trials for possible therapies. Outside of medicine, we had researchers in the humanities, the social sciences, and in other fields working on insights and interventions to improve remote education, to reduce the spread among incarcerated populations, and to understand how pandemics have exacerbated inequality. We believe this model of accelerating the application of knowledge has promise across countless fields of research. We also believe that the history of academic advancement and the ability to attract some of the world's brightest minds to Stanford uniquely positions the university to help accelerate discovery and application. We also want to amplify these contributions and drive new large-scale sustainability solutions to the challenges we face. Clearly, the pandemic is top of mind these days, but the opportunity to apply this acceleration model presents to a number of issues facing humankind. One of these is the warming planet and the effects that climate change is having on us individually and collectively. We will hear later from Dr. Chris Field, a renowned climate scientist, on climate change solutions, including research focused on coastal flooding, as well as the increasing level of wildfires in the Western United States and beyond. The past 12 months have also taught us that our world and our educational institutions will likely change even as we move out of the COVID era. One of the fundamental changes is through the intense experiment with moving our operations to online. From remote education to telehealth to work from home, faculty, staff, and students have found new ways to study and work this year. Just as one example, Stanford Medicine used to provide 2,800 telehealth consults a month. We now are providing more than 3,000 every single day. We expect this surge to continue well beyond the pandemic, particularly as additional tools to support remote healthcare visits become more common. Things like home blood pressure cuffs and other devices that link to medical records. The opportunity that this provides to make education and healthcare more accessible long after COVID has subsided creates tremendous potential at Stanford and beyond. The third lasting change will be through a recommitment to advancing the university's public mission. The pandemic has made it absolutely clear how interconnected all of us are who live and work in this region. We rely on the commitment and sacrifice of frontline workers who are members of our own communities, including healthcare workers at Stanford and other hospitals. We depend upon our local businesses, those people who provide us with groceries and pharmaceuticals, and take-out meals, and much more. We also have the opportunity to have been reminded what a remarkable place in which we live and the amazing natural majesty and beauty of the Bay Area. Whether it's hiking the Dish, visiting one of our Bayland trails, or enjoying other parks in the region, or maybe even just driving north on I-280 as the coastal fog cascades over the Coast Range at sunset. Pre-COVID, the relative ease of travel, not to mention our ability to connect with anyone, anywhere in the world, could make it easy for us to take advantage of what a remarkable place we call home and our community in which we live. Staying in this area and staying home for this extended period has made it clear how much we all depend on one another. We have faced COVID standing together. And as we emerge from this pandemic, we at Stanford are committed to strengthening our ties. To that end, our program will close today with reflections from Stanford alumna, university trustee, and neighbor, Srinija Srinivasan, who will talk a bit about her own Stanford story, as well as describing some of the many ways you can deeply engage with Stanford. We are exceptionally pleased to have so many of you join us today, and we look forward to you discovering more ways to engage with Stanford, virtually and eventually back on the farm. Welcome again. Thank you for joining, and we now turn the program over to Matthew.
Thank you very much, Martin, and thanks to you all for joining us today. I'm going to talk a little bit about the legacy and role of the university, as Martin said. And this is a university that has a very particular story. And I want to share some thoughts about that story and what it means to us today and how we're thinking about the next phase of the story. So I'm going to share my screen and share a PowerPoint, some slides. And I want to just in advance give some thanks to some colleagues who have been instrumental in helping put together some of these materials and sharing their thoughts with me, including Laura Jones, our university archaeologist, and Josh Schneider, our university archivist. So as I've been reflecting about the university's story, one of the things that has come home, and it was just highlighted in Martin's remarks, is how important it is that we are embedded in much, much bigger stories. That the story of the university is the story that is about the larger world. It's the story about our society. It's a story that has multiple histories. And this has obviously become vividly important to us with COVID, and we have become so vividly aware of how the interconnectedness of the world impacts our story and how our story then impacts the world around us. The story of Stanford could be told with a much longer arc. We could talk about the natural environment. Martin mentioned the incredible beauty of this area. We could talk about its history, its geology, and we'll hear a little bit about the ways that our specific area helps us to do research that helps us to understand the broader issues around climate change later on today. We could also talk about the history of the North American West, and the history of Stanford is very much embedded in what has happened with America, with the sense of what the West meant, with the sense of forward-looking feeling that the founders of this university had. And we could also, and we should also talk about the history of the people who have been in this area before Stanford was founded. So as many of you may know, The campus is located in the traditional area of the Muwekma Ohlone tribe. And this people has been here for thousands of years. People left tangible signs across this homeland, and we actually care for many of such sites. We partner with the Muwekma Ohlone tribe on community-led archaeology, historic interpretation, and a native plant garden. And our partnership has deepened over the course of the past years to a place where I'm very thrilled to be able to recognize the tribe as partners for the university in many activities. I think that recognition of our embeddedness in this place and in this broader history is something that's very important for the story of the university. But if we're telling the story of the institution itself, the story starts, as Martin said, with tragedy. As many of you know, the story really is the story of the death of Leland Jr., as Martin said, and what his parents did to make a memoriam in his honor. So Leland and Jane Stanford, this is them in 1850, before they came to the West Coast, were very significant members of the West Coast population. Leland was the governor and senator. He'd earned a fortune by supplying provisions to the 49ers, mining for California gold, and later as one of the big four, as they called it, the Central Pacific Railroad, which laid tracks eastward to meet the Union Pacific and complete the Transcontinental Railway. And Leland and Jane had no children until, after nearly 18 years of marriage, they finally had a child, a son, Leland Stanford. This is Leland Stanford Jr., who was born in 1868 when Jane Stanford was 39. So this was their only child, and this was a child born late in Jane Stanford's life. It was a child that they knew they were not going to be able to replace when he died. And so the death of little Leland is not just the death of a child, which is always tragic, but is the death of an only child who was the only legacy that the Stanfords had. And I want to share one of the things that we found in the archive, which moves me incredibly. This is a telegram that Leland and Jane Stanford sent to their friend Mary Hopkins at little Leland's death. Our darling boy was taken from us this morning after an illness of 3 weeks with typhoid fever. Pray for us. And that those words across time really speak to the tragedy and the depth of pain out of which this university was born. One of the things that meant was that when Leland and Jane went to figure out how they were going to honor the memory of their child, they were very intentional about it. They were very thoughtful, and they had a sense of purpose about the reasons for which they were going to found an institution. And they decided to create a university that was from the start untraditional. It was coeducational at a time when most universities were all male. It was non-denominational when most were associated with a religious organization. It was practical, and they specifically said they wanted to produce cultured and useful citizens. The founding grant of the university states that the university's objective is to qualify its students for personal success and direct usefulness in life, and that its purpose is to, quote, promote the public welfare by exercising an influence on behalf of humanity and civilization. So when the university was opened in 1891, it was a great day, and it was a great day that had a sense of purpose and meaning behind it. It was a real desire to have good come out of tragedy and to give back to the world in a way that was deeply, deeply embedded in the Leland and Jane Stanford's own experience of the loss of their son. And when Jane Stanford wrote about this in 1891 at the opening of the university, and this is the picture that we're looking at right now, she said, "It was born, this university, it was born in sorrow, but it has now become a great joy in our hearts." And that sense of being born in sorrow and becoming a joy and giving back and having purpose is a value that I think we look to today, to this day, as one of the guiding factors of the university. So the university opened in 1891, as I said, with about 555 students. And soon after the opening, Leland himself died. And there were very turbulent years in the first years of the university. There was a season of financial instability after Leland had died. Jane Stanford actually had to sell her own jewels to keep the university going for a couple of years. And there was an enormous number of issues to be addressed. And through it all, the university moved forward, really grounded in that sense of purpose with which it was originally founded. And Jane Stanford herself was deeply, deeply involved in that, moving it forward until her death in 1905. Now, Jane Stanford died in 1905, and the following year, the university experienced another great tragedy. On April 18th, 1906, a magnitude 7.9 earthquake struck the San Francisco Peninsula. The Stanford campus was badly damaged without power or water or heat, and obviously it was devastating for the entire Bay Area. What you're looking at here is the university's boiler house, which was crushed by the collapse of the huge smokestack. The boiler produced steam and drove the dynamos that provided the electric power to the campus. And one of the people who died, there were two people who died on Stanford's campus that day, was the night watchman, Otto Gerdes, who rushed back into the building to shut it down and save the campus. The building was eventually rebuilt and is part of the Archaeologists Center today. The scale of the architectural destruction was incredible. So you can see from these slides, there was originally a memorial arch at the front of the campus that was devastated and never rebuilt. The church was heavily destroyed. The quad heavily destroyed. And immediately in the aftermath of the earthquake, Stanford looked to its fundamental purpose. It looked to the research and the teaching and the learning that it is expert in, and tried to figure out how those elements of its mission could move the university and the world around it forward out of this earthquake. Here you see that members of the geology faculty and their students went into the field to trace the fault and to provide important records of the event. They're actually up in the foothills near the dish in this slide. Students actually were living in tents because the buildings were unstable and they couldn't get home for a little while. And while they were living in tents, they worked on campus to help assess the damage and do cleanup. And they also worked in nearby communities. And this is the second thing that I find moving about the university's response and what our community came together to do coming out of that earthquake. The students partnered with the people of the Palo Alto area and all the way up into San Francisco to try to volunteer on cleanup and on efforts to really make the damage from the earthquake, to mitigate the damage from the earthquake and ensure that the community could come back together. And you see they actually got official passes from the university to do this, which is a wonderful record of that event. And perhaps most importantly, the university started to develop expertise in architectural structures and how they can survive earthquakes. And so we used that expertise here to rebuild some of our own buildings on campus, but that expertise has now become expertise that can be shared with the entire world. And actually, the studies on earthquake stability that Stanford was able to pioneer coming out of that experience have been able to solidify structures and save lives around the world since that experience. And that sense of using the crucible of tragedy to draw on purpose, to really think about usefulness and think about how to contribute to public welfare, is a really important lesson that I think we take from that particular experience and from the moment in Stanford's history where the world impacted us in such a great way. And it really was done in partnership with the community around, with experts from around the world, and with the students and their families who really devoted their time to making this possible. Finally, it really drew on the university's strengths: research, discovery, and learning. As we think about those strengths that we have to bring to bear to other situations in the world, those lessons are the ones that I take home. The 20th century saw a number of developments at Stanford, and I'm certainly not going to touch them all. Many of you will have in mind the pioneering work launched in some ways by Frederick Terman, who was engineering professor and then provost of the university and dubbed the father of Silicon Valley. Stanford became an area that had not only expertise in science and technology, but of course, a breadth of disciplines that all came together to develop new discoveries and exciting things that made a difference in the world. And many of those became the companies that we know of as the core of Silicon Valley. And many other ones became discoveries that made a difference for the entire globe. And that sense of interconnectedness of that research and the sense of how it comes back together to the work that happens here developed in a very organic way over the course of the 20th century. One sign of it that I always think about is that in the Cold War era, one of the many things that Stanford developed was the dish. And Martin touched on the dish and its importance as a symbol of the university and also as a place and an environment where people can experience the university, the built environment, the natural environment, and the community together. It's so interesting that that is something that came out of a scientific need that is about the radio telescope needs that were developed at the time, but that actually then became something that was iconic for the community. And that sense of embeddedness in ways that are not always initially known is one of the other lessons that I take away from that moment in the 20th century. Now, like many institutions in recent years, we've also been challenged to reflect on the aspects of our story that may be out of step with our values today. And in particular, we are deeply, deeply committed to values of diversity, equity, and inclusion. And as those values are ever clearer for entire society, they're also values where we want to reflect on elements of the university's history that may not be in sync with those values. And we've been asked to investigate those questions by members of our community, both internal and in the area around, and we've done so. So there are two areas in particular: the naming of certain campus features after Junipero Serra, and the naming of other campus features after David Starr Jordan, the university's first president, where we were asked to think about whether the values that those individuals represent are values that we want to continue to manifest on our campus. And these are complex and difficult reflections. And I don't want to get into the details of all of them, but I want to say that as we thought about how to pursue those reflections, we thought deeply about those fundamental founding values, about research and teaching and discovery, and how important it is to have a process that's grounded in evidence, that's grounded in learning and education, and that's grounded in our ability to communicate with our community about what our values are. And we also thought about the way that the university is embedded in a changing world, and that it is incredibly important for us to be able to be thoughtful about how the institution needs to change, hewing to that fundamental sense of purpose as the world around us changes. And we did make some choices to do some renaming. We renamed campus features, some but not all, that were named after Junipero Serra. We renamed campus features that were named after David Starr Jordan. And one of the things that that's allowed us to do is to tell more stories, and to tell more stories about other members of our campus community who may not have been honored, to tell a more multifaceted story about the university's history and to bring in other voices. And that's a project that we've just begun and are continuing and are very excited about. Now, as we look at where we are today, as Martin said, COVID has really given us an incredible kick in the pants, I would say, as it has for so many others, about our interconnectedness with the world. And part of that is that a global pandemic obviously has very local consequences, and they have local consequences for us as well as for everyone else. And part of it is that the work that we do and the ways that, as Martin said, we've been able to pivot towards really addressing some of these global issues then has a different kind of global reach than what we might have anticipated, even in the years before COVID. And Stanford has been incredibly impacted. You see here an image of an empty campus, and we've been really struggling with how we continue to keep our fundamental research and our fundamental teaching going during this difficult time. And we also want to take this moment to really think, like we did in the earthquake, how do we come out of this moment of great tragedy and great difficulty into a situation where we can use this for the good? And when we do that, we really look to our sense of purpose. We look to that fundamental idea of usefulness, of engaging with the public welfare. We look to how we can use research, teaching, and discovery to make a difference. And fundamentally, as Martin says, we look to this as a moment where we can re-engage with our sense of public mission in the world and with the way that Stanford is embedded in a much larger story of the world around us. We're going to hear more about that from other speakers today. But the legacy that I want to leave us with as we think about Stanford and its institutional story is a legacy that fundamentally is about intentionality. And it's about being founded to try to serve the public welfare and to create cultured and useful citizens. And that as we reconnect with that fundamental intentionality, it gives us a real exciting opportunity to tell the story of Stanford in its next phase in a way that's going to amplify that impact and that sense of collaboration. Thank you very much. I'm going to turn it now over to Bonnie Maldonado, who will be our next speaker.
Thank you very much for that really comprehensive overview. And I am Bonnie Maldonado, and I'm sorry about that. I was, my computer, I lost the connection there all of a sudden. So I'm back. And I wanted to, I'm Bonnie Maldonado, and I'm the Taube Professor of Global Health and Infectious Diseases here at Stanford. And I wanted to try to share a couple of slides with you, wanting to try to keep in time here, and wanted to discuss with you some of the work that we have been able to do at Stanford. I am an infectious disease epidemiologist by training. I do a lot of work in global health and infectious disease trials around the world. And so I will try to set up my slides here for you. They seem to have now disappeared from my screen. So one of the things I wanted to highlight was the Stanford impact on the COVID pandemic, and what you heard before around what we have been able to do over time. And unfortunately, I think I've lost my slides as well. So let me see if I can open them up. I'm so sorry. Here they are. Okay. There we go. All right, so now we're back on track. Sorry about that. So as I mentioned, I am a professor of global health and infectious diseases here at Stanford. I'm also the Senior Associate Dean for Faculty Development and Diversity at the medical school and co-director of the Global Child Health Program. Most of my research over the last several years has been in global child health, in vaccine implementation and policy in lower and middle income countries, also in outbreak response to diseases such as cholera, Ebola, HIV, and others. So this is very similar to the work that I found myself having to deal with just about a year ago now, when we realized that we were starting to deal with COVID-19 here in the San Francisco area and specifically on Stanford campus. And along with my colleagues here at Stanford and around the world, I feel like we've really developed a major and robust research program. So I want to share just a few details of that with you so that I can give you some time to ask questions about what you think about COVID, particularly I imagine around vaccines and therapeutics. One of the areas that I think is really important here is to look at the pandemic in a historical perspective and an epidemiologic perspective. So this is a book called House on Fire, and if any of you are interested in history and infectious diseases and how important they can be, as you've seen recently, on our entire world, this is a book written by Bill Foege, who is an infectious disease epidemiologist who at one time worked at CDC, at the Centers for Disease Control and Prevention. And he wrote this book around his efforts to eradicate smallpox. And one of his colleagues, an Indian physician in India, where he was working on eradication of smallpox, said these words: "If a house is on fire, no one wastes time putting water on nearby houses just in case the fire spreads. They rush to pour water where it will do the most good, on the burning house." And that really has been our approach here at Stanford and around the world, is to really try and focus on that burning house. How can we get to it rapidly? How can we put out that fire? And then we can get to the embers around us and see how we can really reflect on our ability to deal with additional downstream issues that will evolve from this pandemic. And more than that, how can we build on our knowledge from this pandemic on prevention and address and mitigation of future pandemics and other natural disasters? And so when we talk about the Stanford approach, I just want to talk at a high level around a number of areas that we've been able to deal with here. And I'll show you a website that you can look at that really talks to the more than 400 projects that have evolved on the Stanford campus in all 7 schools since we have been involved with this terrible pandemic. The first thing I want to talk about from a medical and a scientific perspective is that back about a year ago, we were waiting to figure out how could we diagnose this disease. Now, a fundamental way to deal with any disease is to have a diagnostic test. And what we realized last January, when we knew there was a disease that could be coming from other parts of the world, and we were worried about how to screen here in the US, and more specifically here at Stanford in our hospitals and our patients that come to see us on a regular basis. How could we start to identify patients? How could we start to see if we could mitigate transmission here? And how could we start to understand the science of this particular virus and the epidemic that may have been imminent at the time? And so at the time, the federal government was developing a test called a PCR test, polymerase chain reaction. It's a way that you can amplify a gene many hundreds of thousands of times over so that you can detect it and diagnose a specific infection. That is, if you took a gene from a particular virus and were able to amplify it enough so that you could detect it in a typical laboratory assay, then you can actually say somebody has evidence of infection with X virus or Y bacteria. Well, the CDC test really was a long time in coming for a number of reasons, in some ways beyond their control. And that test finally did come to us at the county last February, January and February, but it wasn't working very well. There were some flaws in the design of the kit. And so we were really stuck not knowing how many patients we had. And because the symptoms of COVID-19 are fairly non-specific, they can be a febrile illness, they can be influenza, they can be a lot of different things. The clinical diagnosis was not going to help us. So what we were able to do here at Stanford within the first week of March was we were able to get FDA approval for emergency use authorization of a home kit that we developed here in our Stanford laboratories for a SARS-CoV-2 PCR. And that test allowed us to identify people who were infected with the virus immediately. And it really did give us a very good sense of what was going on in our communities, in our hospitals, and also opened up the doors for us to do rapid diagnostic tests and others. Now, to date, we have done over 250,000 PCR tests in patients in this area. And because it was such an integral issue and so difficult to achieve PCR testing, we also offered this test to all of our colleagues around the Bay Area, around California, and even in other states while people were waiting for other tests to come up. So I think we really played a role, not only here, but around our communities, of our scientific communities outside of Stanford, to help people identify patients and do their own work. In addition, very rapidly, I would say by March or April, I and another colleague of mine, Upi Singh, were actually given permission to develop and deploy clinical treatment research units. And these were very interesting opportunities because there were tents that were out in the Galvez field that many of you may have seen. And they were initially used to start doing COVID PCR testing, but it was rapidly understood that we did not need all those tents to do the testing. And we were allowed to take control of 2 large tents and a few of the smaller tents in order to immediately respond by doing clinical treatment studies. And some of us actually had access to repurposed drugs, that is, drugs that were available for other indications, but that seemed to work against this virus, at least in the laboratory, and for which there was already safety data in humans and animals. So we were able to start right off the bat in March and April, developing treatment studies that we continue to this day. And so far we have at least 5 studies going on right now in our units, and we've done another 2 that we've already completed and published. One of them, unfortunately, did not lead to a new trial, a treatment, but the one we're almost done with now, one that I'm leading, looks like it could be a very promising combination treatment for people who have disease that is not quite evolved for hospitalization, but could prevent hospitalization. So we have some early leads that we are excited to share soon. In addition, because of the rapid expansion of the patient population of COVID here in the hospital, and because of the expertise of our clinical investigators and physicians, we actually were on the cutting edge of treatment studies in the inpatient side, that is, in people who are already hospitalized, some on ventilators and other forms of oxygen therapy. And these studies here at Stanford, in collaboration with other centers around the country and around the world, led to the first emergency use authorization by the Food and Drug Administration of an antiviral called remdesivir. And we were very fortunate to be part of that group. In addition, a cross-campus transdisciplinary group called the Innovative Medicines Accelerator is a group that's really trying to discover ways to develop methods for drug development and technology development in rapid fashion for a number of different diseases, not just COVID. This obviously, the IMA was around well before COVID, but it really was able to pivot rapidly and partner with, and particularly with me and some of my colleagues, to really take some of the medications and drug therapeutics that might be available and try to see how we could deploy those for clinical treatment studies in our unit and in other places as well. And in addition, that group has really launched a really important initiative around what we call human systems vaccinology. vaccine prototyping, and a novel tonsil biobank. And I won't go into a lot of details, but essentially we have a very novel approach to approximating the human immune system by using tonsils, human tonsils, which is really something that is very simple and at the same time very elegant. And this is done by one of my colleagues, Mark Davis. And he has really been able to demonstrate that human tonsil tissue can be a very good marker for what the human immune system can do to respond to different diseases. And so using tonsil tissue is much easier and much more straightforward and better for people than trying to do studies directly in humans. And so there are people who obviously have their tonsils removed. We can use those tonsils and create a biobank, that is, bank those tonsil specimens and use them to test different vaccine candidates in the tonsil tissue and see how the immune system will work. And using that biobank and others, we can then start to develop prototypes of vaccines and use our vaccinology systems approach to look at a transdisciplinary approach, that is using immunologists, epidemiologists, and other types of scientists to try to understand as a whole, how well can we predict whether a vaccine will work in people or not, so that you save lots of time and also don't need to involve human subjects as quickly and can use biological systems to answer a lot of the safety and effectiveness questions before you start human clinical trials. In addition, one of the other areas that we have just recently developed, again in our laboratories, and by the same investigators who developed the PCR test, we now know that there are viral variants of the SARS-CoV-2 virus around the world. And we can talk a little bit about that in a bit. But basically what that really means is that we know that viruses mutate. They mutate all the time. And we are concerned about those mutations because we want to make sure that those mutations don't affect either the way the disease manifests itself in humans, but also that any immune interventions such as vaccines or monoclonal antibody treatments can still work even with variants circulating in the community. So one thing that we have done here is we have set up a nice and very thorough laboratory surveillance program. So now our clinical laboratory is able to look at every single positive SARS-CoV-2 PCR test and determine if there's a possibility of a variant in that sample. And so far we have tested several hundred samples already coming through our lab, and we can track whether variants might be in our population or not. And because of privacy issues, I can't really talk much about that, but suffice it to say that we are not surprised by what we're finding. We're reporting our data to the county and the CDC, and it is actually, you can find information about variants on the CDC website, cdc.gov. And there is an area where you go to COVID-19 and you can find out how many variants have been detected in California and the rest of the country. And then finally, I just want to talk about some of the other studies that we've been doing around population-based surveillance. So working with individuals in our communities, not just at Stanford, but around the Bay Area and hopefully around the country as well, eventually, using innovative software platforms that we've developed here, and actually setting up physical spaces in county and other facilities around the 6-county Bay Area. And these have I've been led by me and by other faculty here to try to understand how the virus is transmitted from patient to patient, from person to person, what are risk factors for transmission, and eventually where would be hotspots that we would want to help our public health colleagues to prevent infection in areas that could look like there are hotspots that are developing within their county borders. And then finally, with the advent of vaccines, we can start to follow people in these populations that we're working with over time and see how well the vaccine is working in those people. That is, how often are some of our cohorts developing COVID infection after they've been vaccinated. And with a biobank that we have, so people are donating blood samples as well, can we track evidence of immune gaps that might be occurring, either because of normal immunity gaps that we would see from a vaccine, or because some of the mutations that occur in some of the variants around the world, if they come to the US, are these variants then breaking through and causing infection? Now, we don't worry about that now, but it is something that we want to keep track of in the future. So I will say one other thing, that frankly, our Stanford community has really rallied together to help support all these scientific work. A lot of these things that I do for a living and many of my colleagues do really are dependent on grant support. Now, grant support takes some time to write and takes time to be funded. So the average time that it takes to get a federal grant is about 9 to 12 months if you're extremely lucky and get funded right away. And it can take longer than that in many cases. So the fact that from the time that we understood this virus was around, say in late December of 2019, early January of 2020, to the time we started doing work, which was in January, February, and March, all of that was funded directly by our own laboratories, by other sources of direct philanthropic support for people who really wanted to see something happen to address this pandemic. So we are now able to develop, because we have access to data and results, we are now able to write grants and are writing grants actively to get federal funding to continue these studies. But we were really grateful to the immediate support by our communities to help us do a lot of this work, which really does cost time and money just to do some of the laboratory experiments and really the testing that is needed to go forward. And so I'll stop with this last slide, which is overall our university response to COVID-19 has been extremely robust. The rise.stanford.edu website, which you see a picture of here, can give you just a broad overview. Now, you need a Stanford ID in order to get into the actual details of each of the studies, but we have at this point today, I have counted 438 unique research projects representing all 7 schools. And these range from topics such as economic impacts, policy impacts, technology impacts, health and wellness impacts, and more. And so we have really been able to develop quite a robust response. Are we done yet? Absolutely not. This pandemic still is facing us, and we are facing it for months and years to come, likely. The impacts will be felt by all of us, but our investigators, our clinicians, our students, and our teachers will all be dealing with these issues that you've heard before in terms of what we know now and what we think will happen in the future, and studying those impacts to learn from them so that we can apply those to future events and hopefully try to stop future events as well. So thank you so much for your attention.
Wonderful. Thank you so much, Bonnie. It's great to hear everything that Stanford's doing to respond to COVID-19. We are a little bit behind schedule, so we're just going to take a couple questions. The first one I wanted to bring up, someone writes, I wanted to inquire if there is a pending vaccination for children for COVID for those under the age of 16. What are your thoughts about our children and COVID vaccinations?
Yes, absolutely. I've been working with Operation Warp Speed, and I'm on the CDC panel that looks at vaccine approvals. And actually some of my colleagues here are also on the FDA panel. And we do know that all of the major companies will be working on pediatric vaccines, and we actually are applying to be one of the sites to do pediatric vaccine trials shortly. So we're hoping that if we can get approval for that those will start in June for children ages 5 to 15, because we know that one of the vaccines is already available for children 16 and above, but there will be more robust trials in children 5 to 15. And if if we're fortunate enough to be a site, we will certainly make sure that all of you find out and ways to be able to enroll children in trials. And we, of course, will make sure that these trials are of the utmost safety and conducted, obviously, under the overview of the Food and Drug Administration.
And here's one that's a bit more technical. I have heard from colleagues that Novavax may be working on a recombinant nanoparticle-based combination COVID influenza vaccine for periodic administration. Could you please comment on this approach?
Yeah, Novavax is considering that. I think other companies are also thinking that about that. And the reason, and so just to explain to others, essentially one of the issues is that we didn't have time to talk about this, but one of the ways you can present a vaccine is by actually taking very tiny particles of the spike protein, and they're called nanoparticles. And what you do is then you present to the immune system many, many hundreds of thousands of little particles of inactive and not a live viral vaccine at all, but just the little protein on the surface of the virus to people, immune systems, so that you can develop a robust immune response. And that is one of the methods that one of the companies is taking on. And the idea will be that at some point, it may be that we will have SARS-CoV-2 around for a longer term than just a year or so, and that we may need continued boosting, and it might be feasible for us to boost along with the annual flu vaccine. So yes, those are being considered, absolutely.
Great. Thanks so much. Next question, and a very kind comment, thank you. I am truly amazed by Stanford's groundbreaking research and its impact on the world. How can young people and high school students be involved as well?
Well, at this point, because of COVID precautions, we aren't even letting a lot of our medical students take part in a lot of these actually active clinical studies. So we are using a lot of support, usually from our medical students, from our undergraduates, and we're highly restricted in who we can bring in because of the risk of developing SARS-CoV-2, even if someone is vaccinated. We want to be as careful as possible. So what we are doing is really offering opportunities for town halls. In fact, right after this, I'm going to be on a high school town hall panel talking to high school students about COVID. So that is one way that we can, our young people can be involved. I would encourage people to come to our websites, to reach out to faculty and see if there are opportunities to have maybe somebody come and speak at a high school. Just realize, however, that we are extremely constrained. Some of us are working, pretty much around the clock. And so not everybody will be available at all the time, but there will be people who can come and by Zoom especially and talk to students. Around research right now we're a bit constrained, but talking to students and maybe having them do their own investigations into what's going on, that you can pull up a lot of the literature online and have them do presentations as well.
Great, thank you. And then we'll close. We had a few people writing in asking about variants and the efficacy of the vaccine and whether or not boosters will be effective. Could you comment generally on that?
So right now what we're showing, and I had a slide, but we don't have time for that, is basically all of the vaccines. There's 6 major vaccines, 2 of which are approved in the US, a third that may be approved shortly, probably by March, and then 3 other vaccines that look that they're very ready to be approved or have been approved in other countries. And all of them have varying degrees of efficacy, meaning ability to prevent disease. They range from about 57% all the way up to 95%. But all of them, every single one, even if people get infected or get disease, that is breakthrough, they all have prevented 100% of hospitalizations and deaths. So even if you're vaccinated with whichever vaccine you get that we have looked at so far around the world, these vaccines have been able to prevent hospitalizations and deaths, maybe not infections. And again, some vaccines are better at preventing disease than others. And we don't know if they can prevent infections. It does appear that they can limit infection. But I do think that at this point, we are going to see drastic reductions in the number of people who get hospitalized and who will die. And that is really a major endpoint and outcome for our global community. And then if we can also prevent infections over time or reduce infections, then we can actually have a better handle on this virus. Now, it may be, as I said, that the virus will be with us for some time, but if we can control it like we can try to do with the flu, we will be very fortunate.
Wonderful. Thanks so much. And we'll go ahead and stop here and take a 5-minute break. We'll come back at 11:07 and hear from Chris Field. All right, and welcome back, everyone. We're going to go ahead and move on to our next talk with Chris Field.
Thanks so much. And thanks everyone for joining today. I'm Chris Field. I'm the director of the Stanford Woods Institute for the Environment and a faculty member in the Departments of Earth System Science and Biology. My work's on climate change impacts and solutions. And I guess I'd say I'm passionate about mobilizing resources on campus and off campus to solve the climate challenge. I've seen a lot of great photographs of Stanford in the last few minutes, and I want to show you one of my favorites. This is a picture of Stanford's first large-scale photovoltaic array. It's in Kern County, and it provides about 50% of the university's electricity, and shows how Stanford is participating not only in the research, but in the deployment of real-life solutions. I want to provide just an update of where we are in the climate challenge. 2020 was the second warmest year on the record. For those of you who talk centigrade, it was 1.25 degrees warmer than the pre-industrial average, and was by far the warmest non-El Nino year. We really are pushing up against the borders of the climate changes that are widely regarded as bringing unacceptable damages. Because with pandemic year, the emissions were down. They were down globally by about almost 7%. And in some ways, this seems like good news that you could say we turned the corner on emissions, but the challenge that the emissions trajectory reveals is that there's still a very strong linkage between economic activity and greenhouse gas emissions. The emissions went down because we weren't flying, we weren't driving, we weren't making things. Another piece of update I'd like to provide for 2020 is that it was a year of incredibly stark demonstration of the impacts of a changing climate. Whether we're talking about wildfires in California or in Australia, or the record-breaking string of hurricanes we saw around the global tropics, there's no question that we're seeing impacts of climate change that are affecting people around the world. And the time short for action, one of the clearest things we know about the way the climate works now is that we have a budget of remaining greenhouse gases. And if we exceed that budget, we exceed the level of warming where the impacts become truly unacceptable. If we look at how long we've got to expand the budget for limiting warming to 2C, an often discussed target by the UN Framework Convention on Climate Change, we need to bring greenhouse gas emissions down to zero sometime in the second half of this century. And that doesn't mean a dramatic reduction all the way to zero. It's a big lift. If we want to limit warming to 1.5C, which has been widely discussed and is called out as an aspirational target in the Paris Agreement, we have much less time than that. We need to bring greenhouse gas emissions down to zero before the middle of the century. And this idea of time is short is a tremendous mobilizer for action. It also should be a reminder that if the global emissions need to reach zero by the middle of the century, the emissions from those with the financial resources and the technological expertise to do it faster really need to step up to the responsibility to move even more quickly. But it's also a time of amazing and vast and attractive, compelling opportunities. This is a photograph of Stanford's Central Energy Facility, completed a few years ago, cut 68% off Stanford's greenhouse gas emission, is projected to save the university over $400 million over 35 years. We also have lots of opportunities in adapting to the climate changes that are already occurring. And that adaptation can occur through things like using controlled fire to decrease the risks of wildfire, to building improved networks for communication and transportation so that we can do a better job helping people when disasters do occur. We also have a tremendous range of opportunities in the policy area, and in particular now that the US has rejoined the global community in tackling climate change, we have opportunities to build the kind of virtuous cycle that's going to be necessary to accelerate progress. I'll say a couple of things about each of these opportunities. So in the area of mitigation, decreasing emissions of greenhouse gases by changing our energy system, we've already reached a point where electricity from renewables is cheaper than electricity from fossil fuel almost everywhere. And the big problems aren't getting the cost of the electricity down, it's figuring out how to do a better job with storage and how to do a better job of getting the renewables deployed around the world. We also know now that we have a wonderful set of opportunities for removing carbon dioxide from the atmosphere through taking better care of natural ecosystems, whether that's protecting forests locally or protecting forests in the tropic, restoring lands that have been degraded as a result of past agricultural or forestry activities, or simply doing a better job of taking care of coasts and agricultural lands, a vast range of options, and we can do a substantial amount of the work we need to do in improving natural ecosystems. And we also have a tremendous range of opportunities in the policy space, whether it's a carbon tax and dividend, an agenda that was championed by George Shultz, who tragically lost last week at 100 years old, or whether it's improved finance, or really importantly, thinking about the jobs of the 21st century, the set of options for compelling work in the policy space is really just getting to be brighter and brighter and brighter. I want to speak in closing just for a couple minutes about the Paris Agreement, because it really nailed down two key principles that can animate our work going forward. The Paris Agreement was an international agreement on the surface about how much we should cut emissions, but even more important than that, it's an international agreement about what's a fair way to approach this problem. And every country agreed, especially now that the US is back in the mix, about how we should think about tackling the climate problem and how we can generate a virtuous cycle where increasing ambition in country A leads to increasing ambition in country B, and so on. And perhaps even more important, the Paris Agreement laid down a foundation for a predictable future, a predictable policy trajectory, so that around the world, individuals, companies, states, countries can make commitments to build on progress going forward. And it's really important to have some level of predictability in order to establish the framework that's going to work. And then I think that the most encouraging thing about where we are in terms of policy is that the discussion has shifted away from just protecting the climate to understanding that protecting climate and protecting people, especially through a justice lens, are equally important. And now we have, especially with the Biden administration, a vibrant conversation about what it means to establish climate justice at home, not only in terms of protection from the worst impacts of climate change, but also in terms of understanding that there are people who will lose their job as a result of a transition to renewable energy. And we need to think really hard about that. There are some parts of the country that are going to be impacted more by the economic changes and by the climate impacts in other places. And we need to think really hard about that. We also need to think about climate justice around the world. And just as there are some parts of the US that are more susceptible to climate damages, there are parts of the world that are already seeing totally unacceptable impacts of climate change. And there also are many countries that can't afford the technologies that are going to be necessary to solve the problem. And we need to redouble our efforts to come up with mechanisms not only to drive the prices down, but to think about ourselves as a global community with saving all of us as the top priority. I'm proud to be a part of Stanford's efforts to do this, and I look forward to your thoughts on how we can be even more effective in the future. Thanks so much.
Wonderful. Thank you so much, Chris. And we would love to get some questions in from the audience. I had a couple here. One person is just asking sort of a general, what are the most important things the average citizen can do to help manage climate change?
You know, I think of your everyone's opportunity is having three big slices. There's your lifestyle, your investment style, and your vote style. Lifestyle, we all make important emissions decisions every day. When you purchase your next vehicle, look at electrics. When you purchase an air conditioner, look for the most efficient model. When you think about upgrading your house the next time, think really hard about increasing the efficiency of the installation or the efficiency of the lighting. In terms of invest style, we all are investors, whether or not we think of ourselves as actively managing a portfolio, but just being sure that when you make investments, you're sending a signal about the importance of climate change in the activities of the companies that you're involved with. And then in terms of vote style, I think the contrast between the Trump administration and the Biden administration in terms of the emphasis on the climate topic is incredibly instructive about how much it matters, who's in power in the federal government, at the state level, and at community levels as well. And solving climate has to be an all-in activity, and your vote can make a huge difference in making sure that the issue gets the priority it deserves all through the political spectrum.
Thanks. Another question, is slowing population growth part of the policy discussion for protecting the climate? I don't hear about this, but it seems like that would reduce energy demand.
It's a really good point, and there's no question that having fewer people in the future puts less pressure on emissions. And there's every indication that an economically efficient way to tackle climate change is to make sure that aspirations for family planning investments are met around the world. On the other hand, this is also a problem that needs to be tackled in the very short run, and many of the issues with population dynamics unfold over many decades, and we need to recognize that dealing with population, while an important slice of the problem, isn't going to have the most impact in the short run.
Thanks. And next question, is it true that the carbon dioxide CO2 emission went down during the lockdowns around the world last year? And I think sort of extrapolating from that, what does that help us think about as we look forward going into the future?
So globally, CO2 emissions were down by about 7% last year. And it's a reflection of the fact that there was less air travel, less car travel, less manufacturing. And historically, there's been a very strong link between economic activity and fossil emissions. The whole idea of this transition to a renewable energy system is to break that link. And unfortunately, the fact that emissions fell last year when economic activity fell shows that we haven't yet broken that link. And so I think that there are important lessons for decarbonization from the pandemic in things like empowering people to work from home, but we shouldn't overread into the emissions decrease in 2000 that we're really where we want to be in terms of solving the problem.
Okay. This is sort of following up from that. Do you think it will have a temporary or a lasting impact on climate change?
After the 2009 financial recession, there's a very quick bounce back of emissions. I'm optimistic that there will be some important lessons that we learn from dealing more effectively with the pandemic, or particularly in terms of things like when travel is important or what our priorities should be, and that we can nail down many of those things about the way we work, the way we interact with each other, the way we enjoy the world that we live in. And I hope those lessons will increasingly be a part about the policy discussions for mitigating climate change, for adapting to climate change, and for building strong policy.
And it's kind of a practical question. How would limiting greenhouse emissions affect how society functions and our everyday lives?
The thing that is maybe most attractive for me about the way that the set of climate change solutions is coming together is that they're not really about giving up on important things. Mostly what we're seeing is that effective deployment of climate change solutions lets people live better, more rewarding lives, whether it's the better performance of an electric vehicle, or whether it is not having to put up with a long commute because you've figured out how to work effectively from home. I think we're seeing lots and lots of cases where the climate change solution is a better solution from many different perspectives, and that's where the emphasis should be in the future.
And another question, it's been 40 years since Washington tried and failed to pass federal legislation to address climate change. Projecting this forward, 40 years takes us past mid-century. How will we fundamentally change government leadership?
Well, it's important to remember that there has been progress in decreasing emissions. A lot of the progress has come from improvements in technologies, things like driving down the price of photovoltaics, or even fracking, which has allowed us to replace coal and electricity generation with natural gas. But there is a need for a much more systematic approach to the policy. And the contrast between the Trump and Biden administrations as an illustration of how much difference there can be. But the fact that we still don't have legislation means that we're not where we need to be in terms of really nailing down policies and making things predictable. I hope that as the recognition of the assets, the advantages that the solution brings gets nailed down, we will see movement in that direction. I hope that as appreciation of the seriousness of the impacts we're already facing is nailed down, that we'll see more pressure. And there's nothing like public activism in order to push for solutions, so that in the short term, we at least see the federal government begin to come up with the level of kind of climate commitment that we've seen in California over the last couple of decades.
Thank you. Another question, what mechanisms are in place at Stanford to help and boost innovative environmental technology?
Well, I think Stanford has been over a couple of decades a wonderful ecosystem of experimentation, and some of that has been through the traditional research pathway, and we have lots of different pools of seed grants or collaboration enhancements in order to encourage people to deploy practical solutions. And in my institute, we really focus on moving things from the laboratory to the stage where we can test whether or not they make a difference in real life. But we also have an ongoing and vibrant interaction with policymakers at the local, state, and federal level. And finally, I showed a couple of examples, but Stanford has really been a wonderful actor in putting solutions to decreasing its greenhouse gas emissions in place. And it's been really fun and satisfying to see the university walk the talk on terms of the transition to a low emissions future.
Another person asks, what is the environmental impact of excess shipping and materials during the pandemic?
You know, there've been lots of discussions that my wife and I talk about all the time. By having something delivered from Amazon, are you increasing or decreasing the greenhouse gases associated with the transportation? And I would say that in general, the studies indicate that it doesn't make a big difference, that if a delivery vehicle can make 10 deliveries on your block, even if it comes 4 times per day, that the greenhouse gas emissions associated with that are not necessarily larger than you making a 10-mile trip to the grocery store and driving back home. But the issue with the transition from having so many things purchased by making a trip from home versus dropped off by a delivery vehicle is a nice example of something where we really need to figure out in detail what's happening. We need to figure out in detail how to minimize the emissions that are associated with that. Vehicle electrification is one step, but just having the routing be right is another important step.
And that's actually a perfect segue to another question. Are electric vehicles and solar energy going to have a significant impact on climate change?
For sure. In California, more than half of our greenhouse gas emissions come from transportation. And if we can transition to electric vehicles, and it's wonderful to see the announcement from General Motors that they plan to make only electrics after 2035, that big slice of emissions can be cut down to zero, particularly if the vehicles are charged with electricity from renewable systems. There are some big challenges in decarbonization. You know, we're much farther from having a non-emitting approach to aircraft or to ocean-going shipping. But there are lots of opportunities for cutting the emissions from light transportation down to zero in a way that will make a big difference around the world.
And this is a very Silicon Valley one. What areas of sustainability startup opportunities do you see?
You know, the area where I see the biggest challenge is in energy storage, but the area where I see the biggest set of opportunities is in really embracing and recognizing the need to adapt better to the climate changes that can't be avoided. We need to remember that this is very much a balance between decreasing greenhouse gas emissions, but recognizing we've already baked a whole bunch of climate impacts into the system, and we need to do a much better job about coping with the impacts that we're not going to be able to avoid.
And we will close with this one, which I think is fun for everyone to think about. What do you consider the most effective activism? There are so many environmental organizations. For the volunteer, are there specific ones that stand out as most effective where a volunteer can choose to engage?
You know, there's another question that I talk about in my family all the time. And I think that each of us brings a different set of skills and perspectives. And I would be very disappointed if there were only one channel of activism. Some people are better at the sort of boring technical conversations with Senate staff or publishing technical papers. Others are better at holding banners up in the street that say we need to act now. And I think it's really important that we recognize and really embrace the diversity of kinds of actions that it could be necessary to solve this problem. And I hope that everybody picks the one that works the best for them.
Wonderful. Thanks so much. And that was a wonderful talk. And we'll go ahead and transition here to some closing reflections from Srinija.
Thank you. Hello, everyone. I'm Srinija Srinivasan, and I serve as a vice chair of Stanford's Board of Trustees. Thank you so much for joining us today. For those well familiar with the work of our university, I'm so glad you could be with us, and I hope this was an enjoyable virtual visit at a time we can't be together physically on campus. And if you're new to Stanford, let me say a warm welcome, and I dearly hope it's just the beginning of a long engagement. We can't wait to fully reopen the campus as soon as it's safe to do so. But in the meantime, do visit us at community.stanford.edu. I showed up to campus as a new freshman in 1989, yes, just in time to experience the Loma Prieta earthquake. Yet I still thought, why would anyone ever leave? And in fact, I haven't left. I've remained in Palo Alto for the duration. I grew up in Lawrence, Kansas on the campus of the University of Kansas, and I mean on campus, next door to an engineering fraternity and across the street from a boys' freshman dorm. So living a few blocks from Stanford's campus now feels exactly as home should be, that I can step out my front door and hear the band practicing or walk to the tailgate fields on a football game day. There's a lot to enjoy for those of us lucky to live nearby, from open space to the arts, to athletics, and of course, the intellectual life. Walking the dish is my favorite way to get a big change of scenery and take in a broader view, often while catching up with a friend. We have access to world-class performing arts through Stanford Live. There's the amazing visual art at the Cantor Art Center, one of the most visited university museums, alongside the stunning Anderson collection, both of which are free to visitors year-round. We can take in college sports at the highest level. And then, of course, there's the vibrant intellectual life of the university with our continuing studies program for lifelong learners, as well as a steady stream of talks, panels, lectures, that are open to the public for an expansive buffet of thought-provoking experiences. You got a glimpse of that intellectual life from Bonnie and Chris today. For me, hearing from our path-breaking faculty is one of the greatest perks of being a trustee. But even from this perch, it's hard to take in the breadth of inquiry and discovery happening across 7 schools, including the professional schools of law, business, and medicine, alongside the Graduate School of Education and the schools of humanities and sciences, earth, and engineering. The disciplinary and interdisciplinary work across these schools is at the center of our mission to pursue knowledge in service to humanity. And that research mission holds unique possibility in a comprehensive research university where all of these centers of excellence are within walking distance of one another in a walkable climate year-round. It's hard to overstate how profoundly this interconnectivity fosters the kind of creativity and collaboration at the heart of thriving academic life. Today's presentations offered a peek into the kinds of vital work happening towards forging solutions to our world's most pressing problems. The drive to find solutions to complex problems is a critical part of what animates the work of the university, from COVID to climate change. The scale and urgency of the issues we face demand a relentless commitment to pursue new ways of thinking, to make new discoveries, to generate and apply new knowledge. But equally important alongside accelerating solutions is our commitment to be rigorous in asking and reflecting deeply on the right questions. There are precious few spaces in our time conducive to the kind of thoughtful consideration the university can make possible. Historically informed, humanistically grounded questioning. It's never been more important that we devote serious energy and attention to framing and uplifting the most important questions. Without this, we'll chase solutions to the wrong problems. We'll find ourselves in a future that we wouldn't have chosen, having missed the opportunity to make choices. Against the extraordinary advances we're witnessing in AI, in biotech, in genetics, and the exponential power of today's technologies, the timeless and eternal questions that we could have once considered the purview of philosophers are now the urgent questions for all citizens to grapple with. Essential questions like, what does it mean to be human? What do we want it to mean? And how will we be to one another? How can we advance our consciousness to wield these new capacities for connectivity towards acting like one species, interdependent, and in service to the earth that in turn gives us life? These questions are as old as humanity, but they take on new urgency in this time. And as we continue to undergo rapid change, it's incumbent on us to keep returning to the questions, to include as many perspectives as possible to the inquiry, and to continually update our thinking so that any solutions we implement reflect our best efforts to determine what it means to be here and what we want from our lives. These questions are at the heart of what President Mark Tessier-Lavigne called the purposeful university in his 2016 inaugural address. And it's this idea of purpose that redoubles our commitment to the tradition of a liberal education for our students. This is liberal from the Latin liberalis, meaning suitable for a free person. The need to prepare students to be free thinkers in a free society is plainly evident in these current times. This sense of liberal also means broad, to equip students with broad knowledge and experience, not just technical or professional training. As this pandemic has sharply amplified, uncertainty is the new certainty. But uncertainty is also another name for possibility. If a defining feature of our future is uncertainty, then our students will be best positioned to make new possibilities from a broad-based education that expands their curiosity, activates their imagination, and exposes them to a wide array of ideas, perspective, ways of thinking, and ways of knowing. In a rapidly changing world, as President Tessier-Lavigne said in that inaugural address, the liberal is the vocational. For our students, for our faculty and staff, for our alumni, and for you in our community, I hope Stanford helps remind us that the world is so much bigger than our imaginations can hold, that we can stay on the frontiers of our knowledge with a sense of wonder and curiosity, eager to learn more and excited to apply that learning towards a better world. For all the serious issues we find ourselves confronting, one thing I've always loved about Stanford is its decidedly West Coast spirit, a pioneering optimism. We heard that from Bonnie and Chris today, and a healthy dose of irreverence. We take our work seriously, but we don't take ourselves too seriously. In closing, let me invoke exemplary citizen, servant leader, Stanford alum, and former trustee, John Gardner, who said these words in 1965, but he may as well have said them yesterday. What we have before us are some breathtaking opportunities disguised as insoluble problems. I hope you stay connected so we can seize these opportunities together. In community, we'll uplift better questions. We'll discover better solutions. Our efforts will be steeped in a greater sense of purpose, and we'll have a lot more fun. Finally, I'll just say, this was our first time out the gate with this public program. Please let us know your thoughts when you get our survey. Reach out through community.stanford.edu. And there you can also subscribe to our monthly Stanford For You newsletter. We look forward to connecting further as we all work towards a better future. Stay safe and stay well. Thank you.